AI is the Great Equalizer.
Yeah, so I'm this huge believer that AI can lead to the democratization of very important information, and it's on probably the operational side. And I just go back to Zillow, and I think, wow, Zillow allows us now to understand home prices and all of that information on a website versus going through, the filings in the courthouse. So then you say, okay, well, where could that really have influence for people? Well, people today, a lot of them have high deductible plans. They need to go get an MRI. Well, I'm going to go to the hospital. Probably the most expensive place. So is there the opportunity for AI to aggregate the information and create price transparency for things that you're going to be paying for through a high deductible situation? You were talking about a hip fracture just recently, or a knee replacement. Again, how do most people get referred to a physician? It's through their friends. But you have no real transparency on the clinical outcomes. So think about it now, a tool like Zillow that says, okay, here's the information on how well Dr. Robinson actually performs knee replacements. And then the last is really understanding that unbelievably confusing area of payment through insurance. So when I think about AI and I look at it and go, okay, what could it do that would make the life of the individual person enhanced in how they access their care? And if they knew what it was going to cost, they knew the quality of the physician, and they understood what was the payment structure provided by their insurance, that'd be game-changing. And AI can aggregate that information. Today, it's available.
It's hard to find.
Oh, and it's formatted differently. You would spend, it'd take you about 5 hours to figure out where's the best location in a city to get an MRI. I think it's, and I look at that, democratization of information. I want to just follow up on that. It does something interesting. When you democratize that information, it results in a power shift. And I think that's a really important thing. So you think about transparent pricing forces a competitive pricing and awareness of what you're charging people. And then you think visible outcomes are going to influence providers to do a better job, or the hospitals to look at that provider's care record. And then the other one is when you now understand what is paid for or not, you can avoid those huge bills that come through and you're like, I thought that was covered. And all of a sudden you've got a $2,000 bill that you thought was covered, and the stress it places on the family and the people responsible for it is huge. Let's avoid that stress.
Yeah. I think you're right. You're basically saying healthcare information is power.
Yes, and shift that power and make it available to the people, the consumers of it. Right now, it's so opaque you can't access it.
Yes.
Wow, it was a little bit of an aha moment for me, because I talked about the annual wellness visit a little while ago. The idea that is I give a patient a plan for their next 12 months, and in that plan is the potential cost that would be incurred for that individual. For me, as the provider prescribing that plan, and for the patient accepting that plan. The example would be, well, maybe I'll do the Cologuard, which we know out-of-pocket costs, but I have to pay for the anesthesia for the colonoscopy, and that could be $500. So thinking about the plan to really make sure that the compliance and how we embrace those plans, I mean, that's fascinating, the idea of being able to do that.
We studied this at Presbyterian, is when you had a medication, and there's some weird interaction with the zithromycin, and when it wasn't covered, there was a 90% probability the prescription got left at the counter. And then you could track back through, and sometimes they'd show up in your office, the emergency room, with significant urinary tract infections or significant pneumonia. And you could see, well, wait, there was the opportunity, proactive again, as you pointed out, there was a script provided through an urgent care. It didn't get picked up because no one recognized it wasn't on the formulary.
So you talked about equity early on, and this is what, with this topic, AI is the great equalizer. I do have some concern that not all parts of our population will immediately be able to utilize this information. And there is a risk, in my mind, that the great opportunity is that this mitigates inequity, right? It makes all this information available and healthcare information, people can make better decisions, but not everybody is going to use that information equally. So how do we think about not having AI potentially even widen disparities? Do you worry about that at all?
I look at it and go, I don't know if you can make them wider than they are now. Think about the disparities that are present between
they're
people
huge.
that can manage the complexity of the healthcare system today. It's remarkably complicated. The other is a lot of that disparity comes through terminology, how it's presented.
Mm-hmm.
You know, and right now if you look at a health plan's payment structure, it's such a complicated document, I think I'm capable. I can't read it. Well, you now look at it and say, well, could you take that, use an AI translator, and put it at the right grade level for the individual? Could it be at first grade? Could it be in Spanish? I mean, I remember at Presbyterian, we didn't have it in Spanish, yet we're in New Mexico. So you look at that and you say, I think those inequities can be brought down, not exacerbated.
I think they can. I think that's just something we have to be really intentional and focused on. The other thing I think about is if we want the AI to really help with inequity, the models have to be trained on diverse populations. If they're only trained in, people think about this, but I think this has to be front and center, is that if we're going to be helping different populations, the AI models need to be trained on those populations, because it's not the same. And the treatments aren't the same, the treatment effects aren't the same. So I think we have to really keep that front and center, thinking about training the AI models on diverse populations so that they actually work.
Absolutely.
We use a term I call the triangle of care. So you have the patient, the provider, and the caregiver, and all those are interconnected. So you really have to work within the system. And really, AI to me is going to become the caregiver, in the sense where it's going to help feed information to the patient and to the provider, help make change. And I think to your point about equity is that we may have to drive more information to that patient so they can understand how we're helping to advocate for them. Where maybe an affluent community may take that, go after the information because it's available to them. So we have to make sure all the information is really pushed at the right level, so that triangle of care just stays as strong regardless of the patient populations we're supporting.